There is a life-threatening health risk looming over every woman that isn't talked about enough. In fact, most people don't even know about it, including healthcare providers. I'm a doctor. I practiced medicine for over 25 years, and still, I've just learned about this recently from research I've been doing about my own health. Now that I do know, I want to spread the word, and I need your help, even if you're not a woman. It doesn't require a lot of time or any specialized medical knowledge to understand the gravity of this. In the next few minutes, I'll explain what the risk is, why it's so deadly for women, and how our healthcare system has failed us. And I'll top it off with 2 immediate steps that women can take. Let's get to it. Starting as early as our late 30s, but definitely by our mid-40s, most women begin to experience a variety of symptoms like sleep disruption, muscle and joint pain, irritability and mood changes, vaginal dryness, pain with sexual intercourse, more frequent urinary tract infections, brain fog, difficulty concentrating and remembering things, and hot flashes. Yes, I'm talking about the menopause transition. The vast majority of us write menopause and all of these symptoms off as an inevitable part of aging. But what I wish I'd known 10 years ago is that in addition to the symptoms of menopause itself, which can be debilitating for many women, and something I'll cover in another video because there are treatment options, I wish I had been aware that this time frame of the menopause transition, the 4 or 5 years before period stop and the first few years after, is associated with a dramatic increase in conditions that can lead to early mortality from atherosclerotic cardiovascular disease. Athero means gruel or paste, sclerosis is hardening, cardio means heart, and vascular refers to our blood vessels. So ASCVD is the paste-like hardening of our arteries that causes heart attacks and strokes. The number 1 cause of death for both women and men worldwide is heart disease, and number 3 is stroke. In 2021, 25% of deaths in American women were due to heart disease and strokes. Most of us are aware that cardiovascular disease is a huge concern for our health, but I had no idea that cardiovascular disease increases substantially with menopause. And this is because estrogen has multiple protective effects that we lose when our levels drop drastically with the decline in ovarian function. The end result is that it's common for women to develop high blood pressure and high cholesterol after menopause, which are 2 of the biggest risk factors for cardiovascular disease. Other changes that happen are redistribution of body fat from the thighs and buttocks, which are metabolically safer areas to store fat, toward our abdominal visceral fat stores that are more pro-inflammatory. You can learn about that here, or the link in the description below. We also develop thickening and stiffness of the carotid artery wall, which is the main blood vessel that feeds our brains. So, after menopause, all of these things are happening silently throughout our bodies and increasing our risk for having a heart attack or a stroke. Our healthcare system has failed us on several fronts. One is that when women develop conditions like high cholesterol, treatment isn't initiated as often or as aggressively as it is in men. And women are underrepresented in studies of cardiovascular disease. But the most egregious failure is that menopause isn't talked about. The symptoms of menopause and the hazards that follow are not discussed as part of routine care. And all too often, women are suffering their symptoms in silence. Meanwhile, they're remaining unaware of the dangers that lurk as they go through this transition. And as a physician, I'm complicit in this. I could give myself a pass because I was an orthopedic surgeon and women's health wasn't part of my day-to-day practice, but still, I knew enough to talk with patients about postmenopausal osteoporosis and the importance of calcium and vitamin D, and even that I did inconsistently. As patients, we get reminders when we're due to have our screening mammogram or colonoscopy, and as physicians, the electronic medical record systems remind us to remind our patients to get their mammograms and colonoscopies. But there are no cautions about the need to check cholesterol or high blood pressure or the other metabolic risks that occur after menopause. And I'm ashamed. I didn't know these things earlier. But not that it makes my ignorance any more excusable. It turns out I'm not alone. This 2019 study of medical residents that were in internal medicine, family medicine, and OBGYN, the fields where this population of women will most often be seen, found that only 8% of the trainees felt prepared to have discussions about menopause, and a full 75% of the primary care doctors had had 0 or only 1 lecture about menopause. I won't waste too much breath pointing out how different these statistics would be if men experienced an abrupt decrease in testicular function and testosterone levels in midlife, particularly if it had this degree of impact on their overall health. I'm also not going to hold my breath for medical education or practice patterns to change. And that's where you come in, because the most effective thing we can do is spread the word among the women you know, especially if they're in their 40s, 50s, 60s, and beyond. And it may also be worth mentioning it to women in their 30s. The average age of menopause in the US is 51, but symptoms can begin 5 to 6 years before menstruation ends. And the cardiovascular risks are higher for women who have premature or early menopause, before the ages of 40 or 45, respectively, or those who experience surgical menopause if they have their ovaries removed at an age younger than when they would have gone through natural menopause. These are women who would benefit from hormone replacement therapy if their other risk factors are low. You don't have to have an in-depth conversation with these gals. Just say, hey, I heard this thing about menopause. When's the last time you had your cholesterol checked or your blood pressure? If they talk about how terrible their hot flashes are or any other symptoms, encourage them to get in to see a healthcare provider to explore what options there may be. Or if you don't want to have any conversation at all, just share this video with them. And here are the 2 action steps for women. Number 1, very simply, pay attention to what you're feeling in your body. If you have any of the menopausal symptoms I mentioned earlier, especially severe hot flashes or mood changes, don't ignore them, and consider getting in to see a healthcare provider. Hot flashes affect approximately 80% of women and are severe enough in a third that it disrupts their daily life and their sleep and their ability to work. And the long-term evidence suggests that the severity of hot flashes can correlate with an increased risk of developing cardiovascular disease. Although there's been residual bias from the Women's Health Initiative that was done decades ago that seemed to overstate the risks of breast cancer, the reality is that hormone replacement is highly effective and highly recommended for severe vasomotor symptoms, hot flashes, night sweats, in women who do not have a history of or increased risk for breast cancer. The second step you can do is memorize this website, menopause.org. If your healthcare provider cannot discuss your symptoms or your concerns to your satisfaction, or if they're unwilling or unable to help you make treatment decisions, you can plug in your zip code on this website and it will give you a list of healthcare providers who are members of the North American Menopause Society, many of whom have had additional certification in menopause management. You may have to speak up, you may have to advocate for yourself, but do not settle for anything less than the care you deserve, particularly for something this important. As mentioned earlier, I plan to do several more videos about menopause, but to be clear, I'm not an expert in this area. I'm qualified to read the medical literature and try to distill key points, but I'd also encourage you to check out these 2 physicians who are experts. I don't know them personally. I've found them through my own YouTube searches, but they appear to have great content, and I've linked to their channels in the description below. Leave me a comment about what your experiences have been trying to navigate your own health journey. Or if there are topics you'd like to see covered in future videos, leave that as well. Gals, it is true. The menopause transition is an inevitable part of aging, but we can reduce our symptoms and the impact that it has on our long-term health. Thanks for watching. Spread the word, share this video, and be well.